We are very honored to be able to share with you a case report on a novel design 3D printing computer-assisted piezocision guide for surgically facilitated orthodontics. The purpose of this report to present a novel 3D computer-assisted piezocision guide for CAPG to allow a minimally invasive periodontal accelerated osteogenic orthodontics or PAO procedure that provide accuracy, adequate visibility, and greater access to the coolant to reach the surgical site.
A 56-year-old healthy female was referred to the Department of Orthodontics at the Tsai General Hospital with a acute complaint of the teeth displacement and frequent lip biting. After 33 months of orthodontic treatment, with a temporary anchorage device, the amount of the retraction did not correspond to the expected amount. After the navigating CBCT image, we determined that the buccal plates of both arches were too thin to keep on retracting. Therefore, she was referred to assess for the PAOO procedures to accelerate tooth movement.
Here is where the CAPG comes in. Clinically, maxillar impressions were taken and scanned as 3D digital files. On radiographic examination, the CBCT image was reconstructed for preoperative diagnosis and virtual surgical treatment plan. All digital files were then incorporated into a CAD software. The CAPG was digitally designed and characterized by buccal slot for performing piezocision in precise location, depths, and angulations. A draining system with multiple pores and drain tubes was designed for great access of copious sunlight irrigation to the surgical site. Finally, the guide was printed by a desktop 3D printer with transparent material to facilitate increased visibility. After sterilization, the CAPG was positioned intraorally by occlusal plate part in the patient's mouth, and the stability and fitness of the CAPG were checked before surgery.
After the stability and fitness of the CAPG was confirmed, full thickness mucodream flow vertical incision could be made along the slot of CAPG to ensure precision and length of the incision followed pre-surgical design. A minimal invasive piezocision procedure was performed using the piezotome solo with ultrasonic tips. The internal light pouches was created for placements of FDBA. Finally, the incision was closed with simple interruptive suture using Gore-Tex sutures.
2 weeks later, the sutures were removed and the incisions healed well without any complications. The patient continued to undergo orthodontic treatment, and 3 and 12-month follow-up photos can be seen here. Prior to debonding of orthodontic brackets, the patient returned for a follow-up CT scan to assess the results of the treatment. As can be seen here, the CT scan showed adequate positioning of teeth within intact bony housing.
To our knowledge, this is the first case report to use a novel 3D printing computer-assisted piezocision guide featuring translucency for increased visibility, rigidity for enhanced stability and support, and the design facilitating greater access for the coolant to reach the surgical site. This innovative design of CAPG is beneficial in reducing time of surgery, increasing the patient's comfort, and facilitating promised treatment outcomes. However, further randomized clinical investigations should be performed to evaluate the reproducibility, accuracy, and efficacy of this novel CAPG.